Hi, it's Dr. Noel Williams, August 7th, 2020, COVID update, Oklahoma City, Oklahoma. So, COVID numbers, we're just shy of 5 million in the country, 160,000 deaths. Oklahoma, we hit 600 deaths, I believe, today. About 42,000 cases, 864 new cases, which was a little better in the last few days. So, relatively in Oklahoma, we've hit the predicted number we were supposed to be at back in the spring for August. Probably only because of the huge surge in cases. I thought we were going to do much better, but that faded. We will continue to have significantly more deaths, but it's relatively less than you would have expected because I think the hospital care is so fantastic and the younger age people are not getting as sick. And I think that's the important point. Yes, we are having deaths, but it's a smaller percentage. Think about the fact that our death rate is easing up, but our hospitalization rate has skyrocketed. And it really gets back to our ICU doctors, infectious disease doctors, hospitalists, nurses, and everybody really having a great care plan for the patients. And I think we really do want to emphasize that the knowledge base for hospitalization and how to treat it, convalescent plasma, remdesivir, anti-cytokine storm type drugs, whether it's interleukin beta or antagonists to interleukin 6 and interleukin 1 or rheumatologic drugs to turn it off. I think our physicians here are just the bomb, as are all the other staff taking care of these people. So what we want to do again is focus on trying to prevent people from going to the hospital. But if you do go to the hospital, I would still argue you're going to the ultimate, you're in the best possible place in the world for hospital care in Oklahoma and Oklahoma City in particular. I'm sure Tulsa's great too, but Oklahoma City, Norman, Midwest City, I mean, the doctors there I know, so they're just the best. So there's no issues with the care here in the hospital. It's the bomb. It's just how do we prevent you from getting there? And that's the big rub to everything, which is so confusing and so hard and so difficult. I've been on quarantine for the last couple days because I had a non-work related primary exposure. Primary exposure is 15 minutes face-to-face within 6 feet of someone who you don't have a mask on. So anyone can figure out who that would be in most people's lives. So because you're not on guard at home. So anyway, I have felt fine. The person who's infected has felt totally fine, other than mild allergy symptoms. And I mean, the only thing, if I have it, which I've been swabbed and now I'm just waiting, as is everyone in our family, is I've been wickedly fatigued for about a week and had some cold symptoms. Maybe I'll get lucky and have COVID and that will be it. But I think I'm just having old man fatigue. Unfortunately, but maybe I'll get lucky. Maybe I'll get lucky, and my overwhelming fatigue is from COVID and not from just being tired, 56, and stressed out. But we'll just have to see. But obviously, I'm fine so far. But that has caused some disruption at the office, and we've had to reschedule. I think now. Oh, I don't know. A lot of people, 80 to 100 patients, and for the last couple days, and a bunch of surgeries, and my apologies for that. But safety first, we can't take any risks with people. We're not worried about anyone at the office being exposed by me because we wear masks all the time. And if you're wearing a mask all the time and washing your hands 4,000 times a day, you're not giving people primary exposure. And you can't have secondary exposures meaning that if I got exposed and then I'm with people, I'm not exposing others. It doesn't work like that. So I'm just waiting on my tests like I did before, and we'll see what happens. I'm optimistic though, because I did through Mercy this time, Mercy Hospital, and they seem to be going like that. So maybe I'll have my results tomorrow or the next day. We'll see. So what did I do with being formally exposed? I did the zinc, pulse, but I'm doing those anyway. I did up my vitamin D and my fish oil. I did start the Plaquenil, and we'll see what happens. Let's talk about Plaquenil though. Really good study came out of Catalonia, and I don't have the whole study. I have the preliminary data, which I'll post tomorrow. In that study, they started people on Plaquenil. It was a randomized controlled trial. Half the people on Plaquenil, half the people on placebo during the first 5 days of mild symptoms. They followed the people. There was no difference in outcome. So that was I mean, and we have to remember whether it's a trial that shows Plaquenil works or Plaquenil doesn't work. Right now we're gathering data. That was a really good trial, the way, without looking at all the methodologies like the New England Journal of Medicine trial, which was terrible. So that one didn't show any benefit. So we got to put that in the hopper and start thinking, what does that mean? Because it looks like a very good trial. Now, those patients weren't on zinc. A lot of the studies augment zinc because zinc is put into cells by Plaquenil, and that's one of its mechanisms of actions. Could that be important? Could that not be important? But again, it's a highlight we need to focus on when we have a better trial on a subject and it doesn't show a benefit, or it does show a benefit. We need to highlight it because we can't be emotionally attached to our interventions. Interventions are a tool to get people better. So this study showed no benefit. So we need to start looking very carefully over the next 6 weeks, which is what I'm going to be doing, on more and more trials that come out. There was another smaller trial in the U.S. That didn't show any benefit, but I haven't seen any of the details on that. So I need, once those are published, where I can look at all the different methodologies, I'll be able to give a comment on that. But I will post the Catalonia trial and the initial data set on it without knowing the details, other than they did not put the people on zinc. So again, important data sets, because what we're looking for is a early treatment that staves off serious infection. And it's hard. It's hard because, I look at my experience with Plaquenil, and it's been really, really effective. Now we're using zinc with every single person we use it on. So, and this study didn't, but you can have an impression as a doctor and think, oh, this is really awesome, but no, it's wrong, because data from science is more important than a personal impression. So we'll just have to see. Yes?
Was that study done for patients in the hospital?
No, it was an outpatient. It was an outpatient. It was an outpatient study. People had mild symptoms of COVID. They were mildly symptomatic patients who were tested. They were all started on the Plaquenil within 5 days of their symptoms. They received the exact plan we do: 200 milligram or 400 milligrams BID day one, or twice a day the first day, and then 200 milligrams. So you go from 400 twice a day the first day to load to 200 twice a day for the next 5 days or 6 days. That's exactly how we do it. And they did not get any benefit. So we'll have to see the final data set on that when it gets peer reviewed and everything. But again, that's how we've been approaching it, except we have zinc as a load at the same time, which is a lot like what they did in some of the other institutions that had success with Plaquenil. But again, very important to realize that this is a complex issue. Along the treatment regimen venue, Fauci came out and said to not expect more than a 50 to 60% chance the vaccine. Well, let me rephrase that. 50 to 60% retardation of disease events with the vaccine. They're setting the expectations really low because, again, they're not thinking the vaccine's going to work that well, because that makes sense. They've never been able to do a vaccine for SARS, so why are they suddenly going to be able to do one for this? So, you can invest in the different companies if you want, but just keep in mind the actual effectiveness may not be that great. We'll just have to see. Again, we need data, and that's the problem. Interesting also on the data front, Bill Gates, the Gates Foundation, is funding a study using Plaquenil with ivermectin. Ivermectin is a dog dewormer, but it's used in humans. It has very potent antiviral qualities. And that gets back to a central concept, because sometimes doctors say stuff like, oh, I don't understand why you'd think a antiparasitic would work against a virus. I don't understand why this would work against that. Well, you remember Viagra was an antihypertensive, but it caused erections. So, things work the way they work. And any of these antibacterial drugs or anti-malarial drugs or anti-parasitic drugs are going to have cross-reactivity against other things. So pretty interesting. The ivermectin works through a different mechanism on SARS in vitro, meaning in lab studies, than Plaquenil does, but it's complementary. So they funded a trial to see what happens. And that's what we need to do before we prejudge that Plaquenil won't work or this won't work. Just like I was hoping there'd be a remdesivir trial, and maybe we'll get one off the ground for an inhalation for outpatient. Because again, I'm about starting an outpatient treatment that could be helpful, but there's not one off the ground, unfortunately. So we would love that. And so that's, again, the focus. How do we treat people before they get really sick besides vitamins? And I think we're still stuck with vitamins as our best choice. So that's really the summary tonight. I don't have much else to add. Wash your hands, wear your masks. Don't go to Sturgis where there's going to be between 100,000 and 400,000 people. Likewise, I saw some other little news snippets. Some students in Mississippi got suspended for taking up a Snapchat and posting it that their hallway of students was jam-packed going into the school. That's a fail, okay? You can't do that. If we're going to open schools, we got to open them correctly. Those school administrators, now they're in Mississippi, so no one's going to yell at me from Oklahoma, were idiots. All the people I've worked with here is like, no, we have to be super careful with entries and exits. I've talked about that a million times. You don't pack people into an entryway or exit. And you need to spread them out, and you need hand sanitizer. Entryways and exits are the most dangerous place, it looks like, for arenas and schools and stuff. So again, why open a school if you're going to do it incorrectly? You need to follow policy and procedure. You need to look at the CDC guidelines. You need to have the desks spread apart. Everyone needs to wear masks. And I'll do a separate post tomorrow just for going back to college for those people. And I probably will do a separate post just for teachers, what my thoughts are on what you can do. But definitely once for college students, what I would like all of them to do. And so we'll go from there. So that's it. Good night. Be safe. Have a wonderful weekend.